thinking about sexual dysfunction, I'd like to have that conversation more or less in parallel, if we can, around male sexual dysfunction and female sexual dysfunction. Erectile dysfunction in males is clearly a form of sexual dysfunction. What is the parallel to erectile dysfunction in females? Is it lack of vaginal lubrication and lack of relaxation of the vagina to have non-painful intercourse? I mean, is it even possible to have a parallel conversation about these two things?
So it's different. In some circumstances, there are homologs, right? So the penis is the homolog of the clitoris.
Right.
So the clitoris is essentially the same sort of spongy erectile tissue that you see in the penis. It gets erect with arousal, and it actually extends very deep into the pelvis. So it's not just a small little organ, it's actually quite long. And so in men, you can have erectile dysfunction because you can see it, but in women, you may have difficulty with orgasm. And it's not exactly a parallel, but difficulty orgasming in women is multifactorial, and we can get into that. But I think they're different, and I think also sexual dysfunction presents differently in both genders. For women, what they can assess is their level of lubrication, if sex hurts, and if they get an orgasm. And so those are kind of the ways you can look at it.
Years ago, I worked on sexual differentiation, and in particular, the role of hormones in sexual differentiation. And indeed, as you described, we learned, because we were taught, and I think people still generally agree, that if one looks at the embryological origins of the penis and the clitoris, they are essentially analogous structures. A lot of male genital development involves literally the regression, the disappearance of the female sexual genitalia and associated organs. Those are anatomical parallels. But what you just described for us very beautifully is the sort of functional parallels as it relates to sexual function and dysfunction.